Good evening, everyone. Let me welcome all my viewers once again today evening on Beyond Sugar. It's always a pleasure connecting with all of you for these live programs. And not only we post information for you on a daily basis so that you are aware and updated about your health, but also to talk to you, we invite leading doctors from across the country who can talk to you as a friend and answer the queries which you have in mind. I'm very glad to welcome Dr. Sanjeev Jasuja today, who is one of the leading kidney specialist nephrologists from the city of Delhi. Sir, welcome to the program.
Hello, Sanjeev. Thanks for inviting me for this wonderful program. And I've heard about it, and I have it has a wonderful viewership also. And I welcome all the viewers in the evening to attend this program. Uh, I shall be talking
So,
about something. Shall I introduce the subject, Sanjeev, or are you going to
yeah,
talk about?
I will. I let me even before I go on to the topic. And we are going to use Dr. Jasuja's expertise today to understand more about hyperkalemia, which is higher potassium levels, and what is the importance of the timely diagnosis and the medical advice. But even before I start taking your questions, let me formally introduce Sir to you. He is one of the senior most nephrologists in our country, and for last 2 decades he has been serving his patients as a senior consultant nephrologist at Apollo Hospitals in Delhi, where he also happens to be the academic coordinator for the department for academic courses. And Dr. Jasuja also is an adjunct associate professor at School of Medicine and University of Queensland in Australia. So many research publications and chapters he has in the books, and he also happens to be the most experienced transplant physician in our country for doing the combined liver and kidney transplant. So we know that we have an expert today with us who can answer all the queries. So let me straight away get you in now and hand it over to you for your opening remarks, where you can tell to our viewers what is hyperkalemia and why it is important for people to know about it, especially those with kidney disease.
Thank you, Sanjeev, once again. And in fact, hyperkalemia is one such area which any nephrologist or any physician who's dealing particularly with the kidney patient has to really take care in it while writing a prescription, while following their patients. Now, what is hyperkalemia? That's something very interesting. See, human body is mixture of both minerals and some kind of amino acids and quite a complex structures. But the most important component which drives our day-to-day activities is plenty of these electrolytes, and the important electrolytes which in our body is sodium, potassium, calcium, magnesium, and to some extent the minor trace elements like manganese, etc. They also contribute, and zinc in a minor way. But the predominant the cations which really are important for day-to-day activity performance particularly is potassium and sodium. The sodium, particularly, is an osmolar gradient, so which maintains our osmolality and blood pressure. On the contrary, the potassium is equally important. It's principally a intracellular kind of a cation, but it drives the journey of neuronal movements from one part to other, like the electrical impulses traverses through the body with the help of potassium. So whether it's a heart or it's a muscles or elsewhere, so it's a component which keeps us active and mobile. Like our heart beats through a impulse which is generated and carried out with the help of a potassium movement across the membrane. Similarly, our all the bodily activities which we do, they are all happening because of the coordination between the neurons through the potassium and the some kind of a synaptic issues which is governed. I will not go into detail, but this is how what is the importance of potassium. But the if you look, as I said, it's a principally a intracellular cation. The small component of it is in the extracellular, which is the most important. But ironically, in this we have a very limited range. The potassium varies in our blood in a very particular equimolar, the kind of a quotient, which is between 3.5 and 5.5 millimoles per liter. And any variation, whether it goes low or goes above, create a lot of aberrations in the system which are governed by potassium. As I said, the conduction systems particularly. So the potassium is a very, very important component of our body. And when our system gets in some kind of disorders, probably the numbers can change and can affect our performances at various levels. So that's the backdrop about the hyperkalemia or the potassium when it increases. That's what we need to take care.
Okay. So I think thank you very much for first of all, sharing this larger piece of information with us. A lot of it was very hard science as well, but for in the simple language for our viewers, potassium is something which is an important component in our body. It is required, and the numbers, the right kind of range is, as Dr. Jasuja mentioned, is around 3.5 to 5.5 millimoles. And if it goes high or less, there can be then, some problems related to it. Sir, moving next, what are the general causes that why, these potassium levels can go up in the body? And let's say, if they are uncontrolled and go up, what kind of complications it can lead to?
See, the increase in potassium is what is considered when our body levels, when estimated through our laboratory assessments, is more than 5 or 5.5 millimole per liter, or you can call it milliequivalent per liter. That's what is called hyperkalemia. And these levels go up not in a normal human body when you have all the organs, all the systems in order. It doesn't vary. It varies between the normal range, which I just alluded a few minutes back, also 3.5 to 5.5. It doesn't change. But when there is a systemic disorder or there is a laboratory disorder, now I mentioned laboratory, many times the potassium value comes high, but actually it is not high in the body because of the sample being kept in laboratory for a longer period of times. And there are a couple of other disorders which are not related to the metabolic systems, like some of the cell quotients going up, like polycythemias, thrombocytosis, etc. These kind of disorders can lead to, if the sample is kept, the potassium level can be found high, which is called pseudo hyperkalemia, which doesn't have any bearing in terms of disease process. It's a laboratory variations. But on the contrary, there are disorders, particularly which causes the potassium, which can increase the potassium level to a dangerous limits or exceed the normal limits. So these disorders principally are related to the kidney, both acute as well as chronic. In acute kidney disorders, the disorders particularly the ones which causes hypercatabolic state in the system. Hypercatabolic state का मतलब ये हुआ that body is into a kind of a serious stress state. So that means that our potassium level, because of that stress, that generally comes when we have disorders like crush injuries or roadside accidents or muscle injuries, or we got acute pancreatitis. But in a chronic disorder, because kidney is not working, potassium is not filtered out of the system, and potassium starts going up, particularly in relevance to the diabetic nephropathy patients, as well as the patients who have a glomerular disorder. There's a very unique system sets in our body, which is called type 4 RTA, where the potassium starts going up. So these are the most common causes. Apart from that, there are certain drugs which are being used for in common disorders like ACE inhibitors, ARBs, and MRAs, plus aldactone, etc. These are pretty common drugs which can lead to the rise in potassium levels, sometimes to a dangerous levels also. And ironically, these are the drugs which we use in majority of kidney patients also for the to slow down the progression of kidney disease. And any disorder which imparts or induces some kind of acidic milieu in the body, which is called acidosis, can also can transcellular movement of potassium can go up into the extracellular compartment. So these are the few common reasons why the potassium goes up in this body.
Okay. No, no. I think so. We can, if we leave the lab-related issues out because that's outside of scope of any patient, then there are the bodily related issues. And you mentioned that one is an acute situation which may happen due to some injury or some immediate issue, but there are chronic issues as well which lead to this hyperkalemia. How can a patient or an individual can identify? Are there any symptoms for someone to identify that I may be having now higher potassium levels and therefore I may need to do something about it? Any warning signals or early symptoms which you can highlight?
Sanjeev, this is very strange actually. It's such a disorder which has a huge bearing on one's, and it has a very on the due course of our discussion, we'll talk about the impacts of this condition on the life. But there are very limited symptoms related to this. Hyperkalemia is one such situation which is in a given set of a patient who are vulnerable to develop it can probably identify through laboratory before any of these symptoms. The common symptom which one can experience maybe as little as some little weakness which was not there yesterday. Today you start feeling weakness, and you might find that your muscles are you feel more lethargy to to create a movement. You don't find that you can do that. You may have some kind of discomfort in the heart. So these are very, very subtle. There are no major definitive defined symptomatology which can be attributed to hyperkalemia. So one has to be careful, particularly when you are defined as a patient that you can have this. Invariably, this is identified by your physicians, and particularly diabetics with kidney disorder or any kidney disorder patients must be very, very careful about it.
Okay. So, as Dr. Jasuja says, on many occasions it can be asymptomatic, or symptoms may be very low, difficult to find out. Sir, from this only, if I I have to draw a question, then help us understand that who may be at a higher risk group, and then what are the measures do you recommend that that is there a role of screening? How often someone should be doing a screening to find out in this high risk group, so that they don't get caught unawares about hyperkalemia.
See, Sanjeev, there are only two groups of patients which has probably the highest vulnerability of developing hyperkalemia. One is the kidney disorder. Any kidney disease patients, there are very few exceptions where one can have a low calcium level, some low potassium levels also, but majority of the renal disorder or kidney disorders, patients have a vulnerability to develop this particular disease. So all those patients who have kidney disease but must be on very, very cautious about this particular condition. They should keep monitoring their levels. Then there are patients who have been prescribed drugs, which I just alluded a few minutes back, like ACE, ARBs, MRAs, Aldacton, etc. These are the drugs which can cause hyperkalemia. Hyperkalemia situations. So patients on these drugs should be very, very cautious. Then there are certain congenital disorder like periodic paralysis patients. They are very vulnerable under specific circumstances where they can develop hyperkalemia, particularly exposure to the cold, exposure to extreme heats, or any stress situations and anxiety. So they can develop hyperkalemia because of their specific cellular level disorder, which I will not elaborate. So these are the patients who are highly, highly vulnerable to develop hyperkalemia, and it's a dangerous condition. So one, if you have these kind of settings, your physician, I'm sure, generally warns you, as I always do in my practice, to keep my patients updated about the situation. And the best way to look at it, if you have any suspicion, if you feel that you're not tested for a while and you're on a drugs, please do a periodic check. Laboratory is the best way to identify this problem.
So again, I think he defines and explains, that who are the people who are at highest vulnerability. So you mentioned about the periodic testing. Can maybe be a little more specific that how periodic, what should be the frequency of testing someone to, to remain in a safe zone? And if, he finds that there is some abnormality in the report coming in, then what are the next steps? Can a physician well equipped to do it, or he should be reaching out to a nephrologist? Any guidance on this?
See, first thing, as I said, the one should be careful about the numbers, which are written in the context to the hyperkalemia. That's whenever the potassium is more than 5.5, it's a kind of an alarm. You need to react to this. That's first part. Most of the times, when as a nephrologist or all those physicians who are treating these vulnerable patients, they invariably sensitize their patients with the fact that their potassium should needs a monitoring. And as and when we prescribe drugs which has a potential to increase potassium level in this particular population, we always warn them. And whenever new drug which has a potential to increase potassium, kind of a set potassium estimations are guided to the patient. Some of the drugs may need as frequent monitoring like twice a week, but once we are very sure that drug has been optimized to its dose and the potassium has not gone beyond a range, then we reduce the frequency, and at some point of time it may go as varied between 3 months to 4 months. But generally, whenever the kidney patients, at least quarterly assessments are mandatory. But for our patients who are been were specifically directed by a physician, it is prudent to follow that prescription or the suggestion, whether it is in 3 days, whether it's in 15 days. So there's a lot of variation from patient to patient, and it's a duty of the treating physician to individualize this to the patients.
Hmm. All right. So I'm sure our viewers are listening. So it's a very specific advice Dr. Jasuja has given, and it's no, one strategy for every patient. But then, yeah, uh, for different patients, the strategy can be different. What you need to be doing is that whenever your doctor is prescribing you certain medicine and giving some advice to you, please follow that, and also follow that the monitoring timelines also which he shares with you. So now, if let's say if a patient is identified timely that this calcium, potassium levels are going up, then is the situation fully treatable, and or let's say if it is left untreated, so can it cause any complications to the patient?
See, what are the implications if you leave it untreated? That's the most important, which everybody must understand. Then only probably you get sensitized to the fact that how quick your reaction should be to this. Because if the potassium goes up, it starts affecting your heart performance, and its heart starts misbehaving to a level. Because as the level keeps going up more than 5.5, the vulnerability of cardiac involvement, cardiac conduction defects is the most important fact which comes in majority of the patients, particularly the kidney patients or the patients who are taking the drugs which increases the potassium levels in the body. So the most important thing is that what is the level and where how should you should react. Most of the patients between the level of 5.5 to 6.5, if it is not an acute rise in potassium level, will not have any major symptom as far as the symptoms are concerned. Even if they report to the hospital, they will do the needful checkings, and particularly the ECG is the important cardinal treatment assessment plan which one has to execute while in ER. And that's seeing the ECG, one can really understand what is the impact of potassium coming on the heart. So from there on, you can decide your treatment strategies. If the heart is getting affected to a level that your T waves start showing changes, then you need to have a very aggressive treatment strategy, but started right in ER itself. ER, I mean the emergency of a hospital where you are reporting to for the treatment planning. So that aggression has to come from there. Apart from that, there may be some patients who may feel muscle weakness, and muscle weakness at times is to such a level that one may have a quadriplegia. It may mimic some kind of a neurological disorders, but is actually a pure simple hyperkalemia, which is affecting the neuronal conduction, and you have a complete flaccid paralysis. And it can go up to a level that your breathing might cease because of the diaphragmatic and the respiratory muscle involvement, and one may have hypoxia and other situations. So the disease, if not managed, or the hyperkalemia, which is very well manageable process, if it is not managed in time, it can lead to uh, effects like heart can cease to beat, and similarly your muscle can cease to work, and you may have a paralysis like situation. So it's a serious condition if not identified. As in, I would recommend all my patients, whenever you see a red flanking brown or more than 5.5 potassium, do consult your doctor. And if particularly if you get a currently most of the laboratories are sensitized, if such a report comes, they have to call back to the patient also.
Hmm. Okay, so I think this is very, very important point which he has mentioned. If the potassium level is more than 5.5, I don't ignore it, please. This is the time for you to immediately connect with your doctor, because if treated timely and you reach your doctor timely, then this is fully treatable. However, as Dr. D'Souza highlighted to us, that if we leave it
I would
untreated
ask,
or
if you're
ignore
not
it.
able to track your doctor, you sometimes it's possible that you may not. It's better to go to the closest ER and get yourself evaluated. And most of the
Hmm.
physicians know how to manage. It's well manageable condition. The ECG would give the signs whether you have to how aggressive you have to treat it.
Right. So I think a lot of emphasis on this point. So generally, as you mentioned that even the emergency rooms are well equipped, or doctors like you, nephrologists are well equipped. So what are the general treatment approaches which you adopt when a patient reports you with a very high potassium level?
See, Sanjeev, the most important thing which we have to impart in cardinal part of the treatment is the cardioprotection. Moment you start seeing ECG changes, I would not describe the changes. Moment you start seeing the ECG changes, the cardioprotection is the number one treatment strategy. And the single one drug which we use is calcium gluconate, which helps us in re-restoring in our technical terms, what we call it, the difference between the threshold potential and the action potential. That's something needs to be re-restored. So that's with the help of calcium gluconate. That's what is given in ERs as a first line of treatment strategy. So there's a complete cardio protection is offered to the patient, and the dosage has to be continued till the ECG stages starts reversing. So that's the key line of treatment. Thereafter, we go to the two other strategies. Is to reduce the total potassium quotient in the body, the total collection in the body. So for there are very specific strategies that includes dietary management, leaching processes. Plus, there are certain drugs which takes away, if given on a regular basis, potassium, particularly at the colonic level. They work these drugs, and these drugs includes the sodium polystyrene sulfonate, and then sodium zirconium cyclosalicylate, and then one more drug which is coming is petiromar, which has gotten FDA approvals recently. So all these drugs and particularly they help us in reducing the potassium from the body in totality, in the net over long term. They keep the patient in a safe zone so that the potassium doesn't go beyond.
Hmm. Okay. So essentially, I think we learned from Dr. Jasuja that if you reach your doctor timely, so there are various treatment options and you can be taken care of well. So now this is a medicinal approach, or when the patient reaches you, and of course you will do the needful. But how about, let's say, you earlier mentioned that people who are at risk, who are at high vulnerability. So are there any things which they can do, especially in terms of their dietary management or their lifestyle changes, which will ensure that their risk of breaching that potassium level is at the minimum?
Now, this is the patients who have been warned regarding the possibility of hyperkalemia, particularly the kidney patient in general, and those patients who are taking the drugs which can increase the levels of potassium in the body. So they must be very, very careful in terms of monitoring. And apart from monitoring, the dietary regulation is the key solution to the entire of it, because most of the diet, what it's only the you can have variability in terms of the potassium level, the delivery by a particular food component, but every food contains some amount of potassium. So one should not be taking potassium, particularly which are rich in rich sources of potassium, like coconut water, fruit juices, and most of the citrus fruits, muskmelon, watermelon, and potatoes. Even the pulses are very rich in potassium. So one need to follow the carefully monitor, not only monitor his levels, he has to monitor his dietary patterns also. Invariably, in my practice, I train my patients to follow the diet spectrum, so that they follow a very particular diet, and the leaching process for all the foods, with all the vegetables, all the fruits, whatever they're consuming, that should go through a leaching process. One can go through the leaching process details in a YouTube. It's available. There are a few steps which you have to follow, but there are you have to train your kitchen people how to cook your food in a specific way, so and it's leached before cooking, so that the potassium component is minimized. I don't think you can totally exclude the potassium from your diet, but you can minimize it, and that can reduce the risk further.
All right. So I think so. Here you make a note of even the dietary habits, which one should follow if you are at a high risk, or if your doctor has guided for that. Uh, at this level, I think there's one question also around from Mr. Bhanu Pratap. Although I don't think so, this is around high potassium levels. But still, sir, if you can read that, he says that his posterior urethral valve PUV surgery was done way back in 98, and BNI surgery as well. And he's stage 4 CKD patients with sodium 142, calcium 9.9. Anything you want to give as an advice to you if you make out anything out of this information?
See, the condition which Mr. Bhanu has an outflow obstruction. Apart from whatever the reason he has got kidney disease, for other various factor might be contributing to it. But what I could understand, he had put stereotypical valve, which had probably infiltrated, and then he had outflow obstruction also. He is one of the very vulnerable patients to develop hyperkalemia, because outflow obstruction can lead to, particularly at the terminal, the collecting ducts, when they come to, there is a specific pressure disorder is created, and these patients have high vulnerability. All what I've just talked in the past few minutes needs to be carefully taken care by Mr. Bhanu.
Okay, all right. So thank you so very much, Dr. Jasuja. We are also running out of time now, and I think you have been very kind to answer all these questions related to this subject. So at this point, I'll thank all my viewers who have watched us live or who may be watching this program later on as well. If you have anyone in your friend circle or in your family who has the risk factors which are mentioned by Dr. Jasuja, you can simply share the link of this program with them, and this conversation can be very, very useful for them. But before I conclude, sir, I give it back to you. Like anything, a few things which you want to say in summary, or any important points which we have missed as yet, and you still want to emphasize on them.
Sanju, I think we have covered majority, but just to summarize my entire of the current proposal which we just created in the last few minutes, all the kidney patients, all the patients who are on blood pressure medicines, particularly, and all those patients who have got outflow obstruction, which Mr. Bhanu just mentioned, they need to be very, very careful about the potassium. And whenever the laboratory information comes with high potassium, you need to discuss it with the closest ER or your physician, or go back to your doctor, discuss with them. There are very foolproof treatment strategies available for a condition which can be otherwise very, very lethal. So I would suggest all patients have a good, safe health, and have a good time. And whenever you have your laboratory, do go back and discuss with your doctors. Thank you very much.
Thank you so very much, Dr. Jasuja. And I think he very clearly mentions to us that what is hyperkalemia and what is the important role also what potassium has in the body. But however, we should be careful, especially those high risk patients, that the potassium levels should not be going above 5.5. And if it goes high, then you should not ignore it. Do not waste time. Immediately, meet your doctor or reach out to the nearest emergency room. Dr. Jasuja, thank you so very much for even with your level of expertise, you were so answer very for the benefit of viewers. I must thank you for this. And for our viewers, if you need more information around your kidney health, you can always visit Dr. Sanjeev Jasuja. He is available at Indraprasth Apollo Hospital, Delhi. However, as he mentioned, if you find any of these symptoms, then and you are watching us anywhere else, in the country, then reach out to your nearest doctors. Thank you so very much, and have a very nice evening ahead. Thank you, Dr. Jasuja.
Right. Thank you. Thank you very much, and have a good day. Bye bye.